You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are joined by ONS member Marlon Garzo-Saria, Director of Clinical Education and Professional Practice at Providence St. John's Health Center in Santa Monica, California, ONS Leadership Development Committee member, and member of the Greater Los Angeles and South Bay ONS chapters, to discuss career planning, which is also the subject of a 2021 ONS Congress session he co-presented on. We've included a link in the episode notes to learn more. Thank you for joining me today, Marlon.
Thank you, Stephanie. It's a pleasure to be here today.
Great. So to start us off, can you briefly walk us through your career progressions and the various leadership roles you've been in?
So when somebody asks me about my career progression, I always go back to my first day in the US. That was just a few months after I got here to the United States and graduated from nursing school back in the Philippines. I applied to a lot of the medical centers in San Diego. I never got any job offers, and the rejection letters all stated that I did not have any experience. So I applied to some of the long-term care facilities after I exhausted the list of the acute care medical centers, and I got accepted as a charge nurse in a long-term care facility. I usually use that story as a joke that my first job as a nurse was a charge nurse, without being a staff nurse. And that was the first leadership role I could ever think of that I've had. Going back before nursing school, in grade school and high school, I never had any leadership experiences. I don't remember being a class president or a president of any school organization, not in grade school, not in high school, not in college. And so being a charge nurse, the title was daunting for me. I will be responsible for staff. And then that was my first job in the US. And for an immigrant like me, his English is a second language and not even familiar with the culture back then, that was really tough. A few months after that, I got offered a job as a new graduate nurse at the University of California in San Diego. So it's a large academic medical center. That's where I started, I guess, climbing up the ladder. So I was a staff nurse for a few years. I then started to become a relief charge nurse on night shift. And that's when I started to see some of those leadership skills come up, talking to supervisors, trying to help place patients on a very busy night shift, troubleshooting, decision-making, that I thought that I was doing pretty good. And then the mentors came in. In career as a nurse, you get to meet a lot of mentors. My clinical nurse specialists who were in charge of the new grad program, I just had the highest respect for them. And I told myself that I really wanted to go back to school to become a clinical nurse specialist. So I guess that would be the next step to the leadership roles that I've had, is being a clinical nurse specialist and an educator at the hospital where I was a new grad. After that, I ventured into research and went back to my silo. As you very well know, research, you work on your own projects. You don't get to really lead a lot of people unless you have a maybe large lab. That was not the case for me. And then the move to Santa Monica happened. CNS position opened up. And just last year, in August of 2020, in the middle of COVID, my chief nursing officer asked me if I ever considered a leadership position. Mind you, I have never been a manager. I have never been a director, but something was different in August of 2020. And I said, yes, I'm willing to give this a try. So you can see that trajectory from being a charge nurse to staff nurse and then to a director of education. And really all of that I credit to mentors and the people who've worked with me and held my hand and showed me the way.
That's a pretty impressive career path. And I'm sure that there's lots in between all of those different steps along the way. So, what did those experiences teach you throughout that?
The first thing that I really want to say is that, leadership is about relationships. It's not the titles. It's not the tasks and the deadlines. I mean, anyone can get those tasks and deadlines done, right? But it's about relationship and working with people and getting them to where you are or getting to where they are. The push and pull of leadership. If you think about it, as a charge nurse, I was a supervisor for the nursing aides in a long-term care facility. They probably knew their job and my job better than I knew my job back then, because they've been in that facility for 20 and 30 years. And here I am, the newbie. And because I had the RN license, I had to be the charge nurse. So you can imagine what that would be like and how easily they would have or could have eaten me alive. But they did not, because I built a really good relationship with them and they actually supported me. I remember that one day when I had to call a physician, I was so nervous. I did not want to pick up the phone. And I asked the CNA, can you just talk to Dr. So-and-so? I would not even remember the name right now. But they did a role play with me before I even picked up the phone. And then I picked up the phone. So none of that would have happened without that great relationship. Supervisor, supervisee, charge nurse, staff nurse relationship. And then there are, in our world in healthcare, there's the nurse physician relationship. So that good rapport with our providers, and definitely the nurse patient relationship. I have a bunch of stories about those, from patients who were yelling at me when I entered into the room to becoming my best friend after about 2 hours. And then the educator bedside nurse relationship, when you get to help them with competencies and skills and even career and professional development. Yeah, it's all about relationships.
I can't agree with you more on that, Marlon. You hear about great leaders and how people work together and work with them. And I really think that you've kind of hit the nail on the head, that it's not about that title, but more so about the relationship that you build and the trust that you build with those folks, whether it's the people that you are leading and in charge of, or the people that you're walking beside colleague wise, talking about the physician and nurse relationship or caring for with the patients. I just think that you've really touched on some really important things that we need to remember as we're growing in our career and what that might look like.
Yeah, Stephanie. So I have a mentor, Dr. Kasari, who actually is the reason why I am in Santa Monica right now. I started at UCSD, or no, he started at UCSD when I was there, because I was at UCSD first. And when he asked me to move to Santa Monica with him, I said yes. But the reason I'm mentioning him is he was the first person who told me, it's all about relationships. But at that time, it never really was clear to me until I became director and I realized how important those relationships are when you have direct reports.
Right. So in talking about those, relationships and the importance of that, what would you tell an oncology nurse that they would need to do to successfully plan and achieve their career goals? I mean, you talked about mentorship, you talked about relationships, but like, how would you encourage someone in that way?
One of the things that we don't do very well in nursing is training or teaching or showing our staff nurses how to deliberately plan their career. And I've seen this a lot. What happens is, you're waiting for a position to open. You're waiting for a nurse to retire and then get that position of leadership, right? But deliberate career planning, I've learned that from the Air Force. I am an Air Force reservist. And that is one of our big tasks as officers for ourselves and for those who we are responsible for, is that we have to sit down with our staff and discuss, where they want to go with their Air Force career. So I really don't see that in nursing as often as I see it in my other work. So deliberate career planning, that we have to be responsible for our career. What do you really want to do with your nursing career? Where do you see yourself in 3 years, in 5 years? I think that is very important for oncology nurses to start thinking about that and start doing it. Obviously, they will need mentors and they will need role models Otherwise, they probably will not know what they would want to do. And they have to be very open to roles and titles and positions. And who knows, what position they might be interested in. So it's just being open.
Perfect. So there are so many different career tracks in oncology nurses. You've talked about a few of them, not only just, the staff nurse, the charge nurse, a director of education, but also research and doing those kinds of things. What advice would you have for a nurse who's unsure of what kind of route they want to take in their career track?
Be open. Be open to the possibilities, right? So if you look at some of the different tracks, or I don't even know the word to use, but if you look at clinical versus education versus management, and in those three buckets, I'll use buckets because ONS loves buckets. When I was on the board, we always talk about buckets. So in those three buckets, you can have different roles. It's just being open and looking around and learning as much as you can from the people you work with. So in the clinical setting, there's the bedside staff nurse, there's a provider, a nurse practitioner type role. In education, there's academic education versus in-hospital staff education, patient education, and then different levels in that: manager, director, educator. So there's a lot of opportunities that are open if the nurse is open to learning those possibilities. Just be observant and look at the people around you and look at what they do, and I guess do a deep dive and think, which of these jobs do I see myself doing in 1 year, in 3 years, in 5 years?
You talked about being open for whatever those possibilities are. As we, or as nurses, look at the various types of jobs that nurses can have nowadays, and they are definitely wide and varied. Just with life in general, life is full of curveballs and unexplained experiences. I mean, holy cow, if this last year hasn't taught us that, or
Right.
yeah, or, put a microscope on that in itself. How can nurses who, maybe they have a plan in place, or they think they have a plan in place or a goal in mind, but because of curveballs and barriers and things like that, maybe that doesn't happen. A door that they thought was open closes, whatever that may be. How would you talk to them about maintaining those goals? Again, you said be open, but like, how would you talk somebody through that? Because so many times those doors get shut. And for some people, that really kind of can shut them down, or, make you feel like, great, that was my goal and now it's gone. So how would you help somebody through that?
Oh, I have a couple of things in mind, and then I am applying what happened in my own situation. Right there's a few of my favorite quotes are: "We cannot change the direction of the wind, but we can adjust our sails." Or the bamboo bends. I talked about being open, so I think of how the bamboo bends in the wind so it doesn't break. It's being open and being flexible to everything that's happening around you. But as a nurse, and using nurse speak, we are all familiar with ADPI: assessment, diagnosis, planning, implementation, evaluation. So after your assessment, you diagnose, you plan, you create your goals, goals of care for the day, goals of the long-term goals of care for your patients. But very often we forget the last part of that, the E, the evaluation. And what we do with the evaluation is we look at what we did, and if the outcomes is not what we wanted, or what not we had hoped for, then we go back and assess again and create new goals. So I guess I'm sharing that because, like you said, if there's curveballs, life throws us curveballs, then we really have to go back to the drawing board and evaluate. So where are we? What other opportunities are open up for us, are available for us? And then how do we go back? We do that assessment, and how do we go back and reformulate a goal or objective that would be appropriate at that time? Definitely 2020 has taught us a lot of things. I think a lot of leaders really grew during that time, especially working around those curveballs and what life has thrown at us, what the world has thrown at us at that time. And that will be a great example. And I'm sure that there are a lot of stories right now that will come out of that experience from those at the bedside. I guess be flexible, and it is okay to change your goals. It is okay to revisit those goals every once in a while.
I like the way you put it to our nurse speak, and that was really good. I think that's going to resonate with a lot of people, and that we do often forget about that evaluation. And so, looking back on, okay, maybe we didn't do it wrong, but maybe we just need to do it different. And how can we make that plan and plan a little different to, get an outcome that we're looking for? So that was a really great way to put it. So you're in a director position now, and, you've got a lot of staff, I'm sure, underneath of you. And, as a director, manager, leader with those staff members, you're going to be working with them on their career paths and how they plan what their path is going to be. And I think that a good leader, director is always someone who, encourages those that they're in charge of, in supporting, to go do better, to go further. Like, I want you to, do better than I did, and to encourage them in that way. And what are some of the strategies that you would use in supporting your staff and helping them?
I will go back to the example that I shared earlier, and that's not in nursing, but my job in the Air Force. So in the Air Force, we have what we call an Airman Comprehensive Assessment, ACA, and that is required for officers every 6 months. And that is when we sit down with our chief nurse and discuss our goals. So as a director, my goal, I've only been in this position for not even a year, for about 9 months, I think. I'm not going to count. It'll take me a long time. And I've done one with my staff, and that was because our evaluations were due in February of this year. So I had to do it. And we use success factors. Probably a lot of our other nurses listening to this podcast are using the same system. But that is the first time that I actually sat down with direct reports and discussed what their plans are, what they think they need to advance in their career, or what I can do to encourage them and clear the path for them to get to where they are. So it's really taking the time to sit down with your staff and guide them through their career. Like I said earlier, I don't really see that as much in nursing as I do in my Air Force job. And I think it is our job as leaders to help guide our nurses. Succession planning is also not, a very solid concept in nursing. My story or my description earlier was we usually wait for a position to open up, and then we move our best staff up to that position. But there's no deliberate succession planning for a majority. I'm not gonna generalize for a majority of the institutions in healthcare. So it's something that leaders and managers should start to think of and start to do, because it will only help us in the long run. Like, trust me, I've been in that situation recently where half of my staff went on leave, and because I did not do a really good job of succession planning and making sure that people can step up if my staff are out, I have to do the job of 4 people. So it really will help us. It's not it's not about developing your competition. It's really developing people who can help you do your job as well as you develop them.
Yeah, I like that. It's not a competition. It's developing people. That's really important. I think if all leaders thought about it that way, wow, it would be really interesting to see, just how well folks can work together and the outcome of that, what that would be. Because I think that a lot of times that's what happens is people feel like it's a competition or that someone's trying to maybe take their job or something. But really, if you look at it in the developing leaders and developing those people that are going to be able to work beside you and that you're going to do a better job and be able to take care of your patients better and come up with, better planning for processes, just how well that would work out if we did look at it that way. So that's a really good point.
That was a great summary, Stephanie. I'll listen to this podcast after this. I'll record that part.
Oh, good. I'm glad. So I always trying to kind of end us up with a couple of questions that I like to ask you or my person that I'm interviewing. And the first one is, what's something about career planning that is not often discussed, but you wish people knew more about?
That's a tough question. It's not often discussed because we have courses upon courses of leadership and management, the courses available to us, right? So what is not being discussed or often discussed? I guess I'm going to jump to leading yourself because we have a lot of theories about leading people, but we don't really talk much about leading yourself, being responsible for your own career, being responsible for your actions, taking time to rest. I found this meme just a few weeks ago, and I actually shared it with my chief nursing officer. It was a really great reminder for me at that time. So the meme was, everything works better after you turn it off, or will work again after you turn it off. And those are the things we don't talk about. It's usually we talk about how do you do more and get more and work more, but we've never really talked about those downtimes that are really necessary. I work a lot. There is a lot of work that needs to be done. That's not working 12 hours, 14 hours, 16 hours, 7 days a week. It's not really something that a leader should be proud of, right? And we should not be role models for that. We should show the people who are direct reports how we can achieve a balance in life of getting the work done and also taking care of ourselves. So leading yourself by taking care of yourself was not often discussed until COVID happened. And now there's a lot of podcasts and sessions about taking care of yourself. So in a way, that's a good thing that we are starting to talk about it, but we need to do more.
That's a great one. I agree with you on that. And I like that meme. So what are some misconceptions about career planning in oncology nursing?
So I'll use something that I learned from being on some of the committees with ONS, and that would include being on the board, being on the leadership development committee, and being on the Congress planning team. The misconception is that most qualified candidates will get the job. And I'm sharing that because sometimes with board positions, you can have the most qualified candidate, the most polished CV. But if the seat that needs to be replaced does not fit well with that CV, then we will have to look for a candidate that will meet the needs of the organization. Again, deliberate planning for what the organization needs. So it's not always the person with the dual doctorate that will get the job. There are positions that we will specifically look for a staff nurse. So it's a misconception that the most qualified candidates or the highest degree candidates will get the job. The credentials can only get you so far. There are other things that are looked at when it comes to career planning and leadership. And also, I don't want to spend a lot of time on this, but I said credentials can only get you so far. Attitude is just as important. And so that needs to come across during interviews, whether it's in your job or in the professional organization like ONS.
Well, thank you. I think that, your point about the most qualified candidate is, a good one to think about, or that it's not always the highest credentialed, that sometimes you are looking for a bedside nurse, a staff nurse, who is kind of down in the trenches and in that every day. And I think that is encouraging for staff nurses that are going to be listening, to encourage them to shoot for something like that and shoot for a position, maybe on a board, whether it's of ONS or some other committee or organization or something like that. Because, I think sometimes if, they only see highest credentialed folks in those positions, they may feel that they aren't qualified. And they do have a lot to bring to the table. And I think that, sometimes when you also bring them to the table, it's a really good opportunity to mentor them, and you may mentor them further so that they become one of those higher credentialed folks sitting at the table. So that's a really good point about, really looking at who it is that you're looking to fill that position and not necessarily just based off of other things.
So you said something, Stephanie, that I guess I want to be clear that there's nothing wrong with having the high credentials, right? But you said it in a very positive way. It's that for the staff nurses who may think that I will not be slated because I don't have a PhD, that not having a degree should not be a barrier for them to aspire for those positions, because they don't know what the organization may be looking for, and they might be the perfect fit without them knowing. So don't let those lack of credentials, if you will, stop them from seeking leadership positions.
Great. So if you're talking to your nurses and they're asking you questions about, what they can do, and you did mention that there's lots of training out there, but is there anything specific that you would encourage a nurse who would come to you about additional training or education to advance their careers or to, whatever their career goals are? Is there anything you would recommend specifically?
I don't have anything really specific, but I guess a general statement that it is okay to go outside of nursing to look for courses on leadership. It's okay to look at other disciplines or other industries when you look at leadership. So don't just focus on the nursing section in your library, if there's even still a library right now, to look for management philosophies in nursing or theories in nursing leadership and management. We can definitely learn a lot from Starbucks. And then, those books are out there. Just don't limit yourself to nursing, because there's definitely a lot to learn from the rest of the world. Also, I guess I'll take this opportunity to jump on one of the things that I always tell my new grads is invest in yourself. So don't wait for the organization to offer you free CEs or pay for courses. If your organization will not pay for continuing education courses, consider that your investment in yourself. You're investing in a lot of other things. I think investment in yourself is really worthwhile, and it has done wonders for me. So just a tip.
Good tip. Are there any specific resources for nurses, who are wanting to learn more? I mean, we have kind of talked about that just even in what you just said, but do you have any specific ones that you might want to tell people about? And with you being on the leadership development committee, are there any resources that the committee would recommend or anything like that?
Absolutely. So, ONS, of course, after I said, go outside of nursing, and then I will recommend go to ONS. But seriously, though, ONS has a lot of resources for oncology nurses and leadership. So look to your professional associations. I am a member of the Oncology Nursing Society. I am a member of the Philippine Nursing Association. Very different organizations, and I'm learning very different things for them. But all those professional associations have resources that are specific to their membership. So you can start there. But I'll go back to what I said earlier. Don't just limit yourselves to them, but they are a really good place to start.
Well, Marlon, I want to just thank you for being with us today. This has been a great conversation, and what an amazing career you have had so far, and just some great points to help those who are going to listen to our podcast today. Do you have any final comments for us?
I just really wanted to thank you, Stephanie, for inviting me to do this podcast. 20 years ago when I first got here to the United States, I would never have thought of being invited to something like this. I guess even I am surprising myself these invitations that I'm getting. How did I get here? And why am I here? So it's really it's good to think back and see and share my experiences, to be able to share the experiences with those who are listening, and the younger nurses, that they can be up here and they can even go higher. So thank you for this opportunity.
Thank you, Marlon. It's been a pleasure. And you definitely are someone that those new nurses and upcoming leaders can look to and just see how you have moved along your career path. So thank you very much.
Thank you, Stephanie.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.